This is part 2 of the Start Triage video presentation by Clark County Training Division. This scenario that we're going to utilize for the remainder of this presentation is going to be, as you see it, it's a train derailment, and it has been declared an MCI. Your engine company arrives, and your company has been assigned triage. You collect the triage material that is necessary to perform that task, and you go out to the field. Remember the motto or the mantra of triage, and that is you start where you stand. And the first patient that you're going to encounter is a 20-year-old female, approximately 20-year-old. She's non-ambulatory, and she's sitting next to their train car. The first thing we want to assess is the respiratory rate, and it is 16. That falls within the normal parameters of between 30 and 10. So we move to the next criteria, which is perfusion, and her capillary refill time is 4 seconds, which is delayed. It's not normal, and so we have enough information here to categorize her. So what color would you triage tape this lady? And the answer should be red. 16-year-old male, running around screaming that his ribs hurt and he thinks they are broken. That's all information you have. Is there enough here to triage this person? And the answer to that is yes, because he's ambulatory. He would be sent to the green area where he would be re-triaged, treated if necessary, and you move to the next patient. 80-plus-year-old male, non-ambulatory, laying near a wrecked train. We want to assess his respiratory rate. It is 40+. That's enough information by itself to triage this individual. And if you do continue on, you go to perfusion, which you shouldn't need to. But you do find he has a radial pulse, and he follows commands. So really, back up at the very first thing, we have enough information there to categorize him as red. 30-plus-year-old female lying motionless inside an overturned train, not breathing, so we provide an airway. And when we open up her airway, she gasps and begins to breathe. At that point, we really don't care what her rate is, because that's pretty serious. There's no more information that we need to critique her, and here she would be tagged red. 40-plus-year-old male screaming that his left shoulder is killing him and he thinks he's having a heart attack. He runs over to the treatment area. Color? Green. Ambulatory, followed commands. 30-ish pregnant female, non-ambulatory. Respiratory rate's 20 within normal limits. Perfusion, cap refill, 2 seconds within normal limits. Move to mental status. Follows simple commands. So when we have a patient that falls in within the normal criteria of the RPM but is non-ambulatory, what color would this person be tagged? And the answer is yellow. Okay. And a comment on this patient is, even if this lady was ambulatory and had these vitals, she would still be yellow, because we have not been able to assess the unborn fetus, and we don't want her sitting over in the green area potentially for hours not assessing the unborn fetus. So tag her yellow. She'll get set down early on a transport unit and be evaluated, hopefully at the hospital, within a reasonable amount of time. Okay, last patient, 65-year-old male, non-ambulatory, has no respiratory effort, so you provide an airway. and the patient remains apneic after you open up the airway. So this patient would be a black. Okay, that concludes the tabletop scenarios of the START triage presentation. And please become familiar with your Triage MCI satchel so you know what's in it before you need to know what's in it, as opposed to seconds before you need it on that big incident.